I was diagnosed with both congestive heart failure and with COPD, primarily emphysema, and I also have a problem with eosinophilic asthma, which affects my lungs greatly. Originally, I was seeing a different doctor when my problem started, and I made the switch to Dr. Musa at Hutch Regional Medical Center in the pulmonology department. And the difference has been like daylight and dark. He's taken a tremendous interest in my health and in me as a person. We have a lot of respect for each other. There's no doubt in my mind that he has my best interest at heart and does everything he can to help me. And that has helped me not just physically, but I think mentally with all of this as well. It's good to know that you've got good support behind you. Then not too long ago, he started talking to me about a fairly new procedure known as the implantation of Zephyr valves in the lungs. And so we talked about it for a while and decided that it's something that might be of great benefit to me.
So the Zephyr endobronchial valve, it's a minimally invasive procedure. Is known as surgery. It's a procedure that we perform under general anesthesia using a bronchoscope. The goal of the procedure that we place the valve in the most damaged lobe, the most affected lobe from the pulmonary emphysema. The way the valve works, it's a one-way valve that pushes all the air out of the lung, and that results in a deflation of the involved lobe and get all that trapped air out. As a result, the healthier and treated lobe will expand. That would also relieve the pressure from the diaphragm. Zephyr valve has been shown in multiple studies to improve the quality of life, difficulty breathing, exercise capacity, and even lung function test. Patients have shown to perform better, enjoy quality of life, being able to do more after the Zephyr valve.
The procedure was actually, even though it had been explained to me, it ended up being much easier than I thought it would be. From what they tell me, it didn't take very long, maybe an hour or so. And they gave me a full amount of anesthetic, so I wasn't aware of what was going on. But as soon as I woke up in recovery, I could immediately tell the difference. I was able to take much deeper breaths. I wasn't in pain. Really couldn't tell much had happened, aside from the fact that I could see some pretty good improvement right off the bat. What I have noticed is that being out of the hospital, having time to recover now, I continue to be able to take deeper breaths. I'm able to walk quite a bit further than I used to. I used to be that if I would walk, I could sometimes walk 50 or 75 feet and I would have to stop and catch my breath. Also, with my lung problem as well as the heart problem I have, a lot of times when that would happen, I would get tremendous pressure and pain in my chest, and that'd be another reason I would have to stop, and that has pretty much been eliminated. And that's a huge improvement for me. I'm hoping that in the future, as I continue to improve, that I'll be able to become more physically active. I've always been a real physically active type of person, and really had the wind knocked out of my sails because of the illness. But this has helped already, and I'm sure that it's going to continue to help me in the future.